it? Okay, are you seeing the presentation?
Yes, we can see it.
Okay, awesome. So good day, everyone. I am honored to be here to present at COMPA. This is actually my second time presenting. And today I have the privilege of presenting on behalf of my co-authors and I who are working on this paper. And those are Marina Saitgalina, Jennifer Whitelaw, Nicole Hutton, Tom Allen, Joshua Behr, and Dr. Yusuf. So I will go right into the presentation, which looks at partnering to advance equity in coastal resilience, lesson learned for research and practice collaborations in underground projects. Now, just to give you an overview of what I'll be covering, we'll be looking at the description of the workshop, the themes, the summary of discussion points, research agenda, recommendations, next steps, and lessons learned. Now, in November 2022, we hosted a conference, which was a virtual format. It was a 3-day workshop style, and there were 113 participants in attendance over the 3 days. This included individuals in academia, researchers, practitioners, both from the local government, state government as well, and community members. What we found is that most of the participants, they were primarily from coastal locations across the East and Gulf Coast. Now, in looking at a framework for advancing underground research practice collaborations to support equitable coastal resilience, what we found is that there are 4 main themes that kept coming up in the discussions. We had the theme around definition. So how are we defining certain things, certain practices, and then how do we measure those? So it's good to be able to conceptualize and to define when we're working with communities and researchers and academicians. But how do we measure, right? What are the tools that we're using? Who are the people who are curating and administering those tools that we're using? And are they representative of the population, including vulnerable groups as well? We're also looking at decisions or actions. Who are the people in charge? Who are the individuals who are making decisions? And again, who is representing the individuals who are not in the room and do not have the opportunity to speak up and out for themselves? Finally, we looked at instruments and tools. So of course, it's good to discuss the concepts. It's good to discuss how are we going to measure and define, and then who is in charge. But also, how can we come to a consensus when we're looking at underground research projects to say, okay, these are the tools that we need to use in order to engage our communities. And so I will go a little deeper into these themes now. So when it comes to definitional concerns, we found that in the room, there were individuals who, for example, question what exactly do we mean by equity? Right? Because there's this long-standing debate around equality and equity. And then how do we define these? How do we define equity? And whose definition do we use, right? That is important because often what we find is majority rules, right? So who is going to be the one to do the checks and balances and ensure that at the end of the day, we do not only have the majority rules consensus, but we also have individuals who are defining and laying the framework for individuals from minority groups as well. We also found there to be an issue with measuring equity and coastal resilience, right? How do we really measure equity? How do we really measure coastal resilience? What constructs are we using? Whose definitions and paradigms are we using to get to those measurements? We also looked at funding for engaged or applied research. Now, what we found is that a lot of individuals from academia mentioned the fact that there needs to be some sort of incentive, right, for participating in applied research, for participating in the communities. How can we bridge that gap to not only have individuals going in the field only when it is a passion project, for example, or when an organization like NOAA in this research area that is commissioning this project. So how can we just leverage better communication relationships to ensure that funding is sustained across these projects? Now, there's also the idea of support from and for community and community partners, right? So how is it that we're going to get individuals involved from these communities who, and I like to mention the BIMBI, right? Because it's in my backyard, and the grassroots initiatives. How can we continue to sustain and leverage those individuals to ensure that they're participating? So these are some of the main points. And what this presentation aimed to do is to look at some best practices, some way forward in which we can address these. Now, when we look at a research agenda for future applied projects, it's important to ensure that we're educating community leaders and university leaders and administrators on the importance of community-based, engaged, and applied research, and on the need to provide institutional support for and resources to researchers, faculties, students, etc. It's also important to provide researchers to help understand the process for community-based, applied, and engaged research, and offer guidelines and training for building relationships with and engaging communities. So what we're saying is that it's not enough to say we are going to form cross-sector collaboration or research community-based collaboration, but is there training, right? Is there sensitization? Is there education around the topics that we want to discuss? So those things are important. Another point is that we have to build long-term focused and requisite resources into funding and programs or grants requirements, such as accounting for the time to build relationships, compensating individuals or groups in the community, participating in the research, long-term monitoring, or checking back on communities. It is not enough to do our research and then leave the community. Perhaps we implemented a project. It's not enough to just implement and leave, or research and leave. How are we making sure that we're going back in the communities to ensure that what we would have implemented are actually being utilized? Or is there metrics that we need to measure how effective these implementations are? Now, lastly, on this point, we need to develop partnerships with professional organizations that can help disseminate research findings, project results, etc., to complement the academic articles that are emphasized in academia. So basically, how are we ensuring that both community partners and academia, right, research faculties, etc., researchers, students, how are they working together to ensure that there's not duplication of efforts, but not only that, but information is being shared, and it is being shared in an effective manner? Now, here are some recommendations that we have for research practice collaborations. We think, based on the workshop results, that there should be increased funding for engaged or applied research and allow for more flexibility for research to co-produce with communities or community partners. We need to ensure equity in prioritizing, evaluation, streamlining, award, and types of the on-the-ground projects and programs that benefit underserved communities. We need to provide institutional and administrative support and incentives in encouraging and fostering community-based, engaged, and applied research. And we also need to create and disseminate metrics. We also need to create paths, right, and resources to empower community when it comes down to advocacy. Because some of the times what we find is that the individuals who are most interested in being a part of these underground projects are individuals who are advocates in their communities who actually know the issues that are going on in their communities. And then again, it goes back to, because it's in my backyard, right? You have that vested interest. We also need to facilitate training for students, right? Because what we find is a lot of students are not sure, okay, what are the best practices? How do I really engage with this group? That is not known. Now we have some next steps, and the main goal based on the workshop that we conducted is that our main goal is to facilitate successful projects that incorporate applied and engaged research in coastal resilience and social equity. What we want to do is to create a framework, right, to show what community organizations should expect from researchers and the types of partnerships that should be pursued. We need it to be data driven, right? Our actions need to be informed by data. And that is why it's important to come together, both community practitioners and researchers, to make those decisions on what's feasible for each community based on the context, based on the history, based on different social factors. It cannot be a one-size-fits-all approach. Now, the second task is to provide guidelines and best practices for researchers and community partners, and then to identify gaps in research and practice that can be filled by data-driven solutions. Now, based on the workshop, there are lessons learned, right? Now, when we talk about equity-centered, right, what exactly are we talking about? We need to ensure that when we're looking at equity in coastal resilience, that we're looking through multicultural lens, that we're looking at the history of the place that we're conducting this research in, that we actually have liaisons in those communities that we're working with to ensure that the solutions that we're proposing actually make sense for the community. Cannot be just because there's a grant or there's funding that pushes a certain agenda that we just go in with a blanket or wholesale approach when certain community members might not even see the value. So how can we ensure that our research and practical solutions are value added as well? We need to learn how equity-centered approaches can actually be designed, right? And how can these designs be encouraged? And we also need to learn about measures, right? When it comes down to equity-related policy outcomes, what metrics are we using? Who is developing these metrics? How can we ensure that at the end of the day, we're getting metrics from individuals who are not only skilled in this specific area, but individuals are at the table that can speak for the masses and not just one specific group. And finally, how can we identify equity concerns and resiliency policies and how those can be sustained over time? I've come to the end of my presentation, and if there are any questions, I'm sure we will take those at the end. Thank you.
Thank you so much, Ren-Neasha. This is great. You are emphasizing the work of community, or the need to have community representation and participation, and you're doing that through the lens of equity. So thank you so much. I will reserve the question until the end. We'll move on to the next presentation by Dr. Sabharwal and also Mr. Yoon. And it will focus on exploring the impact of diversity-focused HR reforms on performance in government organizations. Now you have the floor. Go ahead.
Thank you. Let me share my screen quickly. Let's see. Sorry. Hold on, please. Okay. And this one.
Yeah, we can see it.
Okay, thank you. Good afternoon, panelists and guests. My name is Youngseok Yoon. I am PhD student studying public and nonprofit management at the University of Texas at Dallas. This study is our mid-product with my co-author, Dr. Sabharwal, studying the diversity-focused HR reform and its outcomes in the public organization. So as we acknowledged, diversity initiatives has been at the core of the human resource reform for more equitable and representative public organization, especially for the governments. They proactively adopt and implement diversity initiatives, but in reality, diversifying workforce has a mixed effect due to the potential conflict between the desire to innovate and to expand our knowledge on the people and community that we serve versus the strong belief in the promises of the merit-based system. So suspicions exist. Merely the diversifying workforce may undermine the accountability of government due to the harmnesses to the unfairness and biases. And the effective diversity-focused HR reform on the accountability of the government through the perceived justice in the organization have been understudied, which our study tried to bridge the gap between the literatures and practices. I'm sorry, I got a little cough. I'm sorry. So before we move on to further, I would like to give some details on the study context. So public personnel recruitment has adopted a merit-based system broadly across the country. So in that system, we hire the best people who got the best score at the exam. But a question remains that the system, the conventional wisdom, still valid for the more diverse and equitable work. So we have concerns more representative government through the balanced personal management systems. So in South Korea, we studied the case of South Korea. South Korea has policy changes on gender quota, which promote the gender equality in public personnel recruitment by resolving at least 30% of the workforce for the underrepresented gender groups. And also local talent recommendation recruitment encourage the hire, actually prioritize the recruitment of the people who are from less populated regions and underprivileged group, mostly less educated or some lack of social economic status. So they have to take the less competitive exam to get the job in the public servant. So both policies focus on the passive diversity practices in the recruitment system, but we argue that more attention must be paid to their effectiveness and accountability of the public organization. So we suggest our two research questions: how the diversity-related HR reform affect the performance in government organization? And also, does the organizational justice, perceived justice in the organization, mediate the relationship between the two reforms and the accountability of the government? So we reviewed the literature and we developed a theoretical framework mainly from the social equity and organizational justice theory and literatures. And we found from the literature review, diversifying workforce can address the challenges of the organization and improve the organizational performance in forms of innovation and learning, as well as the representation and fairness and justice. So literature has produced and obtained pretty much a positive effect of the diversity practices on the organizational outcome, but we acknowledge it. In reality, these practices have produced a mixed result when we try to leverage the tenets of equity over the merits. So there's a conflict and suspicions, like I said. So here we suggest our hypothesis and conception model. Fundamentally, we test two diversity-related HR reform and its effectiveness on the individual and organizational performance. And we also investigate if there's a mediation effect of the perceived justice in the organization. So it looks pretty complicated here, but I will decompose each hypothesis in the later part in the analysis. So we use the data from the 2021 public survey data from the public employee in South Korea. The sample size is over 4,100, and the samples are from the 69 central government agencies and state government in South Korea. So you can see the survey items that we use to measure the survey variable. Basically, we measure the performance by using the composite and the organizational justice. In aggregate term, we use the 3 pillars of organizational justice based on the previous studies so that we can construct the organizational justice term. And the descriptive stats show us that we have a balanced and normal distributed sample here. And interestingly, when we looked up the gender, perceived the effectiveness of the gender quota and local talent recommendation recruitment system, it's below the average. That means they don't think that it's effective in achieving its intended goals. And among the pillars of justice, perceived justice, we can see the perceived distribution of justice is also below the average and unsatisfactory level. So we conduct a measurement model by using the higher order confirmative factor analysis. Here you can see we have convergent and discriminant validity and also the composite reliability to measure the organizational justice, the construct of organizational justice through the three pillars of justice: distributional, procedural, and interrelational justice. For testing the hypothesis, I decomposed each hypothesis in here by using the structural equation model. And you can see the gender quota recruitment. We assume that all of these relationships are positive based on the previous literature. Literature obtaining evidences on, positive association with the performance. But here you can see the gender quota recruitment actually has a negative association with the perceived individual performance, while it has a positive one with the organization performance. But these are the statistics. These are not the statistically significant. For the local talent recommendation recruitment systems, it has a negative association both with the individual and organization performance. So basically, all these hypotheses show that insignificant, except the hypothesis 2A, local talent recommendation recruitment systems. We assume the positive one. We have statistically significant result, but it has a different direction. So it looks like it makes the result in here. So move on to the mediation test by using the bootstrap analysis. You can see the direct effect, like I said, direct effect has a negative one, except the gender quota to the organizational performance. But interestingly, indirect effect has all the positive outcome, positive relation. So in total, when we conclude from the result, the total effect actually change the direction. When we only assume the direct effect, then we aggregate the direct and indirect effect to see it has a positive association with the performance, and all these results are significant. So we can say that there is a strong mediation effect by the organizational justice. So we can argue based on our result, diversity-focused HR reform per se are not directly associated with the individual and organizational performance. Meanwhile, the reform consistently obtained positive association with the performance, then leading to the improved, leading to the positive association with the perceived. through the positive perception on the justice in organization. So basically, we can interpret diversity reform can produce insignificant effect, contrary to the previous literature has obtained its evidence, or even in unintended consequences in achieving its promising goals. So our research contributes to the calling for more attention to the justice perspective in the organization when, every organization. So basically every organization have a strong belief in that the advantage and benefit from the merit-based system that merit-based system gave us. But when we had some clashes between the diverse management practices with the conventional wisdom of the merit-based system, we can reconsider or revisit the perspective of justice and fairness of the employee in the public organization. So empirical evidence of this study can support the recent efforts of the governments to spur more equitable and balanced and inclusive environment in public organization, and making more representative bureaucracy, linking to the government accountability. We have to mention, of course, the limitation of our research, since, like I said, we only use the aggregate terms of organizational justice, so we can see there's a varying effect and result from our data. But if we decompose and break down the pillars of each justice linking to the independent variable and dependent variable, we might think we can get more explanation on the varying effect that we have in here. So that's all I have today. Thanks for your attention. Thank you.
Thank you so much, Mr. Yoon, for your presentation. We'll move on to the next presentation that focuses on work-family conflict in federal workforce, how race and gender impact elder care responsibilities, by Dr. Viswanath. You have the floor. Is Dr. Viswanath here?
I do not see her.
Okay, okay. So then we'll move on to the next. Can we then move on to the next presentation? Yes.
So
By Dr. Schroeder.
yes, sir. Okay,
Mhm.
let me try and share my screen. Please let me know if you're able to see the screen.
Yes, we can see.
Okay, thank you. So good afternoon, colleague. Dr. Agbodzakey and myself, we are the presenters of collaborative governance and childcare, a pathway to socioeconomic mobility, and we're looking at some examples. Now, our paper is a work in progress, so we're still developing and tweaking and trying to put it together. So we look forward to your ideas and comments towards the end. The presentation outline will look at brief introduction. We'll look at the research method. We'll provide a definition of collaborative governance. Then we'll focus on different aspects of collaborative governance, why, or the importance of collaborative governance. We'll look at why collaborative governance and childcare. We'll also look at the Quebec childcare reform, and we'll look at their experience and provide an update after 22 years. And then we'll conclude with some takeaway or or message about collaborative governance and childcare. Now, we all know someone who has faced challenges determining the best childcare option for his or her family, or maybe some of us have also experienced those challenges. Now, it is well known that childcare systems in many countries tend to have a hard time attracting low-income families. And it's true here, it's true for everywhere. In Quebec, for example, Quebec in Canada, 77% of high-income parents use what is considered good quality childcare, but only about 41% of low-income parents do the same. What are some reasons for this? It's that low-income parents are more often without jobs. And when they do hold jobs, they tend to use licensed childcare less often than those of higher income. And if they do use childcare, licensed childcare, we find that they're more often wind up in lower quality settings than those with higher income, usually because low-income people tend to live in low-income community. So that's the setting where the childcare would be offered. Why do low-income working parents avoid good quality licensed childcare? Again, many low-income families find the base daily charge to be too expensive for them to afford. There may not be enough good quality settings where they're living or in their neighborhoods. And the low-income parents may be embarrassed. Some of them may be embarrassed to reveal their poverty to other parents. We therefore need to consider several things: better access to good quality health care for disadvantaged children, and this should obviously be given top priority. Caregivers should be provided with appropriate levels of financial and human resources to respond adequately to special needs of disadvantaged children. Now, the question is not whether or not we should provide childcare services, but how these childcare services should be provided. And should the services be targeted, or should they be universal? The research methodology that we used is a case study. And we looked at CP Behr Daycare Center in Canada. And my co-author, James, spent a lot of time last summer looking at childcare in Canada, and he conducted several elite interviews, and we also used documentary review. So that's what we're looking at so far in terms of methodology. Collaborative governance, what are we talking about? As the name suggests, it involves collaboration. So there's a relationship with the intention of increasing public value when we talk about collaboration. And collaboration may be achieved by working together rather than working separately. And when we discuss collaboration, it is generally based on reciprocity. What then is collaborative governance? It refers to the opportunity for cross-sector stakeholders to collectively make decisions and/or implement decisions to solve complex problems and to promote a common resolve for action. The application of collaborative governance involves decision-making and service provision. It includes a public agency deliberately and directly engaging in non-state or non-public entities. And according to Ansel and Gash, 2007, Agronoff and McGuire, 2003, collaborative governance refers to a formal, consensual, and/or collective decision-making process that is intended to manage programs and to solve problems that may not be easily solved by a single organization. Now, there are several aspects of collaborative governance. And according to Ansel and Gash, 2008, Bryson, Crosby, and Stone, 2006, some of these aspects of collaborative governance include face-to-face dialogue, trust building, commitment to the process, shared understanding, conflict management and planning, leaderships, agreements, legitimacy. All of those are aspects of what we call collaborative governance. Now, we believe that collaborative governance is needed to address the growing complexity of childcare and equality of opportunity. It is also important for investment in early childhood education, as well as to enhance child development, early child development. And we know the societal benefits to doing all of this. The creation of more childcare opportunities through collaborative governance can lead to improvements in work-life balance, and that is very, very important. Why collaborative governance and childcare? Again, you may ask. The overall economic benefit to the state as well as the federal government cannot be understated. Now we can have mandated or non-mandated collaborations which create various paths for viability and socioeconomic mobility when we think in terms of collaborative governance and childcare. And there are some examples. For example, the state of New Mexico was the first state to enshrine childcare funding in its constitution in 2022, effectively making this service a universal right. So that's a model that several other states here in the US could look to for developing collaborative governance and childcare. And like I said, Quebec, Canada, they have experimented with childcare, some form of collaborative governance in childcare, and we're going to be paying attention to some of the insights that we garnered from that experiment. In 1997, the Quebec's Educational Childcare Act was launched, and there was a reduced fee universal program that was set up, and it had two clear objectives. One was to improve work-life balance, and the second one was to enhance child development with an eye of achieving equality of opportunity. Now, after a prudent beginning, shaky beginning, the program became fully operational in the year 2000, covering all children up to age 5. There was a low fee, high quality childcare system set up with the idea of improving not just childcare generally, but improving the overall society and giving back to the workforce itself, giving back some of the females who were not able to join the workforce were now able to participate as a result of effective childcare. Now, why collaborative governance? Again, it's important. The quality of childcare education depends on two main factors. One is the structure of that childcare and the process. The structure here depends on health and safety, physical environment, child staff ratio, group sizes, the teacher's qualification, and the competence of the management of these childcare organizations. And the second factor that's important has to do with the process that is involved. And here we're talking about basic activities that are involved, like educational program, interaction with the children, interaction with the parents, and different stakeholders. Good quality childcare has been repeatedly shown to be crucial for the developmental outcome of any society, but there's a cost that is attached to it. We all know that. In the case of Quebec, the cost of child daycare is $60 if you're getting a good quality, and CPA is really childcare in Quebec. If you're getting good quality childcare, but only about $45 in lower quality garderie or nurseries in Canada. While nearly 90% of the children in the childcare benefit from at least 2/3 of their teachers being qualified, and when we say qualified, we're talking about teachers with college degree and experience in their job, fewer than 20% of the children in full fee galleries or nurseries are in facilities that meet the standard. So we can see that having your children in the fully qualified childcare situation is best and works better for our society and our children. Quebec's childcare system is not a uniform government-run wall-to-wall model, but it may be considered a mix of several types of childcare or care system, all run privately from subsidized or reduced fees, nonprofit centers, early childhood, and we're talking about the CPE, which is early childhood centers, and it ranges from those to full paying fee private nurseries, giving access and even tax refund and tax credit in some cases. Now, this is key. Due mainly to the childcare system there in Quebec, in Canada, the labor force participation rate of young Quebec women now exceeds that in every province and in every advanced country. What that means is that women are now able to go back into the, because of the childcare system that they have experimented with, women are back into the workforce and are able to contribute positively to the society. The childcare system has entailed no net financial costs or fiscal costs, and it has in fact generated surplus and therefore has not required any tax increase. So the taxpayers are not paying for it. The society is actually benefiting from investment in proper childcare. What then is the message that we should take from what is happening in Canada? There's a clear role for collaborative governance in childcare. We should continue to expand capacity to reduce the rising shortage of childcare spaces. We should also respond to parents' demand for expanding the high quality of childcare, either by building childcare centers, new childcare centers, or transforming existing nurseries into qualified, licensed childcare centers. We should think in terms of raise and strictly imposing and monitoring quality standards in every other type of care. So not only just focus on childcare, we could look at elder care as well, use the same model with collaborative governance to improve care in general, childcare, elder care, or any other kind of care that is offered. We should try to attract more disadvantaged children and to respond adequately to their needs. And we should try to make childcare more affordable for mothers, not just mothers, parents, but we focus mainly on mothers so that they can remain in the workforce, in the federal, state, local government workforce. And there should be government subsidies and or private and nonprofit assistance in setting up these childcare centers. We should try to build a coalition of relevant and willing concerned parties through collaborative governance, because it is through collaborative governance that we can achieve what we believe could be achieved in our society as done in some Scandinavian country and example in Quebec. We look forward to your questions, concerns, and ideas during the question and answer section. Thank you.
Thank you so much, Dr. Shilpa, for the presentation. And we'll now move on to the next presentation by Dr. Adam Scooper. We'll be looking at the Fighting for Food Security in Southwest Georgia Project for Community Education, which continues for 60+ years. Dr. Adam Scooper, you have the floor now.
Thank you so much, Dr. James. And hello to our colleagues out there in virtual land. Allow me to share my screen. I have a little sniffle today, so please, overlook that. I know it will be a distraction for me sometimes. Okay. And hopefully I won't need my glasses to be able to see. Okay, I think, there we go. And you're able to see. Good afternoon again. And my presentation today focuses on the social equity, justice, and disparities in Southwest Georgia in terms of food insecurity. The presentation is titled Fighting for Food Security in Southwest Georgia. Southwest Georgia Project for Community Education, Inc. continues a 60+ year struggle. In the presentation today, I am wearing two hats, an academic hat for Albany State University, but I'm also the vice chair for the board of directors for Southwest Georgia Project. The presentation order follows a general article format, and it's a work in progress. The hope is that we will be able to publish it soon enough once the Food Hub is actually operational. The research is a typical descriptive case study, and it's examining increasing food security in Southwest Georgia. If you're not familiar with Southwest Georgia, we don't like to have this dubious honor, but we are one of the poorest congressional districts in the United States. And as it relates to Georgia, it's Atlanta, which is Northwest, but it's Atlanta and everything else in Georgia. For 60-something years, the Sherrod Institute, excuse me, one moment. The Sherrod Institute, through 3 organizations, have worked diligently to help bring justice and social equity regarding various issues in Southwest Georgia, including food security. Briefly, how food security became part of their agenda is this. If you're familiar with the Student Nonviolent Coordinating Committee back in the Civil Rights Movement period in the 60s, SNCC sent Reverend Charles Sherrod to Southwest Georgia. He became the first field secretary for SNCC. And Reverend Sherrod, along with some of the other officers sent, they were able to excite the youth in Southwest Georgia, specifically in Albany, and students at Albany State University. And what happened, the success was so great that too many people lost their jobs because they were involved in the struggle. And the weight of knowing that people lost their livelihoods led Reverend Sherrod, his wife, Mrs. Shirley Sherrod, and other community activists to create a communal setting where they would grow their own food and house one another, have childcare. Well, out of that, years later, we have the regional food hub model that's currently in progress. One must understand the whole issue of food insecurity is not just relative to Southwest Georgia. It's a global issue, has been a global issue for a long time. And in a subsequent table that I'll show, it reveals from a global to a national to a state to a regional issue. What is the significance? When you have your most vulnerable in society impacted at the very basic level of food, you have very serious consequences. The research has shown what food deprivation does to young children in their formative development years. The study context, again, is Albany, Dougherty County in Southwest Georgia. And our objectives are simply for this particular research to examine this particular food hub model in progress, and at some point to add to the practice and policy and literature sectors. This is the table that gives a few data points globally, nationally, statewide, and region-wise as to the issue of food insecurity. And for us as administrators, but then when we put on a community hat, these are real lives. These aren't just statistics in a report. The levels of food security range on a 4-point scale or the upside down pyramid. And for Southwest Georgia, we have too many instances through food deserts and food swamps of very low food security and low food security. Now, when you're in the community, you're not asking citizens, are you at a very low food security level or low food security level? Questions are posed differently. But what we want to do in the work for Southwest Georgia Project is to make sure that many citizens who experience economic and social disparities, that they do have a household where they have access to nutritional, quality, healthy, and affordable food most of the time. Okay. Now, when we explore what a regional food hub is, it has certain characteristics. Mainly, the role as a hub is to be that broker in a system where you are managing how we are getting food distributed, getting it from the producers, getting it to the market, and then getting it back out to the persons who are in need. And you want to do this in the most efficient and certainly effective way. And of course, the goal for a food hub model is to be able to help the producers capture what is needed in the marketplace. And so that would range from just wholesale supplying, retail, as well as institutional sectors. And then ultimately that the consumer is going to benefit from that particular model. Now, we found in 2022 for Georgia, we only had 3 operating regional food hubs. Definitely, once the Southwest Georgia Project food hub is up, the 4th will give us, just greater exposure for people having nutrition in their households. Now, the literature on the food hub being a significant solution to addressing food security shows that it is a promising possibility for areas and regions, not just in the United States, but abroad as well, to use to implement how to access ways for filling those gaps. And we have a couple of the key literature pieces, Clark, Rouse, Friedman, Fisher, Perot, Hammett, oh, I can't even get it out, but Luwani, Madsen, and Thayer. Really good studies on the importance and significance of the food hub model. The methodology, again, is a descriptive single case study. How the data is being collected is primarily through literature, existing data on food insecurity or security if you're using the asset-based lens, and then organizational documents. And for right now, in this exploratory phase, we're just looking at pattern and theme matching. What does the literature say about a regional food hub in terms of characteristics, its roles, supporting the needs that exist in a particular region? Here is a visual of the excitement that came to Albany, Georgia. Going back to the fact that we're one of the poorest districts in congressional districts in the nation, several years back, a trend began where grocery outlets were closing in droves. And it got to the point where we had too many food deserts or food swamps in this Albany metropolitan area. What you see on the screen is an old Winn-Dixie that was on the east side of Albany, southeast side, one of the poor areas in Albany. And so it was donated, the facility was donated. In 1994, Albany suffered a 500-year flood, and it decimated the region in terms of Albany, Dougherty County. Albany State University almost closed, did not. But what has happened in doing all the environmental structure testing and so forth, it was found that this building would have to be raised. And that has caused a significant delay into accessing additional funding. And then we know that COVID had caused a delay for many organizations as everyone tried to deal with this novel virus. So what have we found so far? Well, what we found so far is that it's a win-win. It's a real strong match. What a regional food hub does or is exactly what the Southwest Georgia food hub is going to do. There's a particular name that's in place. It's proprietary right now, so I can't give the name out until all that paperwork is finished. But in terms of the regional food hub, the main issue is, will it really address in a systemic way, a food system way, getting the product to the people from the producers who have it? And this particular food hub will do that. In terms of organizational capacity, this organization does have it. The grassroots mission and support is there. People have been in need for a long time, and the work with Black farmers as well as low-income farmers is in the blood, if you will, of the Sherrod Institute and Southwest Georgia Project. So they have deep roots in the food systems currently in place in terms of farmers, distributors, and markets, and certainly people. Things began back in 2012, and I've already mentioned some of the interruptions in the process. But we are confident, being led by Mrs. Shirley Sherrod, who is the executive director, that soon enough, this is going to come to fruition. Currently, she's one of the USDA Equity Commission members, and she's the former USDA Georgia Director of Rural Development, if some of you remember, who was wrongly terminated by our government for the misconstruing of information regarding racial incident. In terms of the strategic location that a food hub should have, the Winn-Dixie meets that, and the staffing and the programming are in place. So everything is just about ready except for that facility being rehabbed so that it meets the government requirements. So we're really excited about that. That's where we are for right now. And the hope is that as we put this in the literature, it will show the importance of the work of SNCC way back then and what it means in contemporary society. We will be able to address insecurity for food in Southwest Georgia. And ultimately, just getting the funding will help us move to future operations. So we're excited once more about that. And here are the references and contact information. So I look forward to questions at the end. Thank you, Dr. James.
Yeah. Thank you so much, Dr. Adams Cooper. Is Dr. Viswanath here? I received a message that is having technical difficulty, so hopefully could join at some point. If not, we're going to go ahead into Q&A. Thanks to all of the presenters. If you'd like to ask a question, feel free to just unmute and then ask your question. So anyone would like to go first?
I do have a question. Oh, sorry, I should have raised my hand. I'll go back.
If you were saying something, you were muted, James.
Hello, Ren-Neasha, go ahead and ask your question. Thank you.
Okay, I just wanted to be orderly. My apologies for just blurting that out. But I do have a question to the second presenter, Mr. Yoon. My question is, I really find your research area fascinating, and especially in my area of research where we're looking at just public sector reform and, new public era governance, stuff like that. So I was just wondering, based on the quantitative analysis and the findings that you have, if you're looking at perhaps doing a tracer study, or perhaps going with a more phenomenological kind of study, or a qualitative to get to feed out some more of those themes. I'm wondering if you have any insights into that.
Oh, yes. Thanks for bringing up that. Like every other quantitative research analysis, we do have a limitation, because like I mentioned, this case, this policy change in South Korea, it's been around 20 years to spur the gender equality and gender balancing recruitment system. And we do have, there's a interruption to change, and a lot of changes in policy implementation, and also it's strongly affected by the political orientation of the presidency in South Korea, I'd like to say. So a lot of varying effects and results that I found in here could be explained by more the qualitative one, not just the quantitative, because we only have aggregate data from all these agencies. There's no other individual levels of data to reflect the change and their professional experience throughout this policy change. So we do, Dr. Sabharwal and I, we have a plan to do some interviews for the public servant who has gone through all these policy changes, mostly in the executive level. So that's my answer.
Thank you. Sorry, Kaya, I know you raised your hand earlier. Can you now ask your question, Kaya?
Can you hear me? All right, so I have a question for Dr. Adams-Cooper. Thank you so much for your presentation. One thought went through my head. I have a background in like service learning and community engagement, and I understand actually the research that you did is amazing, and it reminds me of some universities that have partnerships with, you know, some of the food banks or even community centers that help provide either to communities or to students, right? So I'm just wondering actually if the program that you did research on, if there are any classes where professors integrate that organization into part of the curriculum where students either volunteer, do service learning or some type of project, right? Or if there are any other partnerships between that organization and the university in general.
Okay, thank you for that question. And how do I pronounce your name? Kaya?
Yes, Kaya. Thank you.
Kaya, thank you. So to begin, for Southwest Georgia Project in particular, they do have internships where they work with the university. And so I am aware of that. Some plans going forward for the public administration department, I just became chair, a couple of months ago, last semester. And as we look to develop our strategic plan going forward, efforts are in place to work more closely with some of our nonprofit organizations, such as Southwest Georgia. Now, in our university, we just started a food pantry for our students, for our campus. So we work with the local food banks, but we have several different organizations working on food security. And about 2 years ago, Albany State, we were working with Georgia Tech and the city of Albany. So when we talk about the collaborative governance earlier, that was intriguing because collaborative governance is certainly important. And so there are efforts to continue those relationships going forward and to get food security at the undergraduate level. That is a consideration for our student affairs division, again, since they just came up with the food pantry last year. So that's a very good question or questions. I'm hopeful that I've addressed them all, and we'll share this back with the campus and community, this feedback you've given.
Thank you. Just one follow-up. How far is the university from the community center? Is it in the same neighborhood or is it somewhere completely different in Albany?
Well, Albany, we're not that big of a city, but it's about 6 to 7 miles away from our East Campus. And so it's closer to going towards the northwest side of the city. Our East Campus is east, and then we have a new West Campus through the merger of the Community College Darton. And so, but we look to strengthen those. And Mrs. Sherrod is one of our alums, one of our distinguished alums. And so she does a lot of speaking at our first year experiences and when we have special programs.
Thank you. Thank you so much. Dr. Hawkins?
Hi, everyone. I have a question for Dr. Schroeder. Did I pronounce your name correctly? Sandra Schroeder. Are you familiar with the National Association of the Education of Young Children? Mm-hmm. So I put it in the chat, but I wanted
I saw your comments. Yes, thanks.
I wanted to share how important your presentation would be at that conference, because there are a number of different individuals that attended, and it ranges from the childcare presenters, not childcare presenters, stakeholders like the owners and the managers, but it also has individuals that actually work in childcare. And so just broadening that exposure into sharing your presentation would be wonderful at that conference. I think I went to it last year in DC, and I think this year it's in Atlanta, Georgia.
Okay, thank you so much for that information. We'll definitely look into that.
Oh, no problem.
Appreciate it.
And Dr. James, I have one other question, and that is for Dr. Adam Cooper. First, I need to, and I took my sticky note down as you were saying the things that you were doing with your department. So congratulations on being the chair, but also congratulations on transforming your strategic plan to incorporate what you want to do with the community. Also, congratulations on the food pantry. Students need that. As a former professor who was working on that at Mississippi Valley State University, it's so great to hear schools, especially HBCUs, that indicate that they are addressing food insecurity with students. That's wonderful too. So my actual question, instead of giving you just kudos throughout your presentation, but my question was, has the organization that you're working with considered food as medicine projects? I am working as a research consultant with Tougaloo College in Mississippi and Tufts University. And we have a food as medicine initiative in the Mississippi Delta. So since you are working and you already have practiced the gatekeeper theory, maybe consider looking into how to start a food as medicine project with the food hub that you already have. And that's all the insight that I really enjoyed all of the presentations, but those two were the ones that stuck out to me based on my interest area.
Well, thank you so much. And I don't see your name showing up on my screen.
So it's Cassandra Hawkins.
Oh, there it is now. I see it. Okay, so thank you, Dr. Hawkins, for the kudos and the comments. Now, and I mentioned about some of the proprietary information, but it does relate to the food medicine aspect that you're bringing up. That part of the project is going to be facilitated through our hospital system, Phoebe Putney Memorial Hospital System. And so that is one of the components of one of the programming pieces. So thank you so much for sharing that. And I would like to stay in touch. I'm familiar with Tougaloo. I'm a Jackson State grad, so I know about the history of Tougaloo. And it's great, that relationship with Tufts. But for the African American community, in terms of the historical disparities for health, food is so critical, and having the proper nutrition is essential. And so when we talk about the whole food hub, it's those fresh fruits and vegetables. It's that good, healthy poultry that would also be part of that process. So I appreciate those comments again, Dr. Hawkins.
So before I move on, you are a graduate of the Jackson State University, and so am I. So that's wonderful. Please stay in contact.
Yes, thank you.
Thank you, Dr. Hawkins and Dr. Adams Cooper. Alicia, what's your question?
Hi, so I'm Alicia Ryan. I go to the University of Baltimore, and I'm a PPIA, which is public policy, fancy way to say public policy major. And I just wanted to say to Dr. Adams Cooper, I've really appreciated your presentation. I mean, I really appreciate everyone's presentation, but I work on Pennsylvania Avenue Main Street in the Upton community, which is in West Baltimore, which is a very underserved community. And something that we have had a really hard time retaining grocery stores within our neighborhood. A lot of that due to, I guess, the high taxes on grocery stores. And then obviously when they move out of the neighborhood, there's also that component of, travel, the barrier of travel to the grocery stores that are outside of the neighborhood. And I was just curious, like in your research, have you found that reduction of those taxes has helped in like retaining grocery stores in underserved communities?
And okay, so thank you, Dr. Ryan, Alicia.
I'm an undergrad, I'm not a doctor.
Okay, I couldn't tell there. So Professional Ryan, for us, we lost a considerable tax base when our grocery stores left. And some of the response has been the city of Albany actually working to bring some grocers back through some tax incentives. And so it was difficult, especially for people in East and South Albany, to get to those outlets for food. And so I would say the negative tax impact is something that the city knew it had to address, because the food markets were some of the economic drivers for those neighborhoods. And once they left, when you have the I forget the terminology, is escaping me, but when the grocery store leaves, then the stores around it that were depending on what those subsequent market, those customers, they then dried up. And so it was very important to get some grocery stores back into some of those food deserts created by the departure of some of the major, the Harveys, the Winn-Dixies, and so forth.
Thank you. I think that that's very true, because you know, in Pennsylvania Avenue, I feel like we kind of ebb and flow, like we get businesses and then, you know, it kind of comes and goes. So I think that's a very astute observation. Thank you for that.
You're welcome.
Yeah, thank you. Lashonda Williams, what's your question?
Yes. Hi. I guess my question is actually to COMPA overall. With, you know, I think a lot of these topics they resonate with us for different reasons. I guess my question would be, is there a way to have, you know, the collaborators and the contributors and the presenters, you know, kind of on behalf or in conjunction with COMPA, start to create some type of repository for resources? Because I think it's important when you're, you know, doing these type of work, so that we can kind of, you know, not just for a conference, but kind of go back to maybe something, a link on the site, to be able to look at, you know, not just the presenters and the work that they're doing, but also the resources. You know, I have children, one of which is a 2-time JSU grad, and others that are in other HBCUs and some that went to PWIs. But I think that it's important just for the narrative of, you know, we're talking about HR structure, and we're talking about, you know, jobs, and we're talking about protecting infrastructure and other things. All of these things, you know, intersect. And I think it's important for us to be able to have some type of repository to go in and, you know, connect together even outside of this space. So I guess that would be something I would be, you know, very much interested in.
Thank you so much, Shonda. That's a very, very important comment. Is Madam President still here? Hello, Madam President. If not, we've taken note. I know Dr. Robert Lewis is here. I'm also a past president. So yeah, we've taken note, and we'll see if something can be done about that. Thank you. Ren-Neasha, what's your question?
Thank you. It's more of a comment than a question. Just to say that I really appreciated the presentations by Dr. Schroeder and also Dr. Adams Cooper. And one of the reasons for that is I am a big advocate for action research, and also research that can translate into practice in some way, shape, or form. And I'm also a wicked problems researcher. So a part of that is looking at these interrelated issues, how they feed into each other. And because of that, I really appreciate the presentations. Another reason is because these are two topics that are well debated too in the Caribbean, where I'm from. I was a part of my university's debate team, and every single time we went to regional debates, we would always debate. There's always a mood on food insecurity in the Caribbean, and there's always a mood on just social mobility and governance, collaborative governance in certain socioeconomic issues. So just to say that this is great work, and it's great to know that there are individuals out there who are doing research that can benefit the community in such an impactful way. So thanks for that.
Thank you so much, Ren-Neasha. Any other question? If somebody has raised their hands and I didn't see it. Okay, I have a question for Mr. Yoon. Thank you so much for your presentation. I really enjoyed it. So I'm just curious, if you should add another variable to organizational justice, what will that be?
So you mean another pillar of organizational justice, or?
Yes.
So we basically, like I said, we basically construct the aggregate terms of justice with the distribution of procedural and interrelational things strongly based on the literatures. So I did the literature review, but I think so the very negative association that we found in our from our data, intuitively we can interpret it in the individual level, in a more deeper cognitions. They think it's unfair. Although in an organizational level, we just acknowledge. I would like to say we just acknowledge or agree to the change or to the initiative into the organization, but in individual level, I don't believe, because a lot of public organizations, they are strongly based on merit-based system to select the applicant from the pool, a lot of pools like South Korea. Just a little bit more comment on that. We have to spend at least 2 or 3 years just to study and prepare the examination for with those who has a bachelor degree. So that's a very competitive one. We have to sacrifice a lot of things, but all is the policy change from the balanced person system. Some of them feel like, okay, it's an unfair, or it's unjust things. So I would like to add more on the perspective of psychological things or cognitive things to explain justice, but I couldn't find at this point, I couldn't find any literature to address that aspect of the justice in just the PA journal or PA article. So I can expand more, I can expand the scope of my research into a more broader perspective, but just, I would like to say just that it's the limitation of our research with our limited data in here. But anyway, thank you so much for bringing up that, I keep thinking of how to construct the organizational justice terms with the more broader terms in here. Thank you.
Okay, thank you so much. We have about 4 minutes. Dr. Robert Lewis.
Yes, thank you, James. It's good to see you here. And Dr. Adams Cooper, yes, thank you. Good to see you. I appreciate all of these presentations, but I wanted to inquire, Dr. Adams Cooper, I missed the beginning of your community gardens. I've been on site tours at least 2 HBCUs that have community gardens on campus to address the issue of food deserts, but also in a way that will allow students to be a part of the process through service learning and social justice and social change kind of initiatives. And I wondered if you had considered that as a plausible way. Oh, Dr. Hawkins is saying that Tougaloo has one as well. And I hadn't made it to Mississippi yet on my site visits, but I'm coming. But had you considered that in any way as an expansion or an extension to your research and a way to engage more of the community and students to have them involved in the process?
Well, it's great to see you, Dr. Roberts Lewis. And I would like to say that we already have a community garden system in place at Albany State and in some of our local schools as well, one of the partners that I spoke about earlier with the City of Albany Collaborative, he is spearheading the community gardens focus. And so one entity is not doing all of the aspects of food security, but actually we have multiple organizations. And so I can follow up to find out what is exactly happening with the community garden, but we do have one in place already. Now, the service learning piece, and I forget who asked that question earlier, Dr. Kaya. For Albany State, we do not have a cohesive service learning model yet. That's something that I tried to do a couple of years back. And for everyone, my area of expertise or focus is community and economic development. And so I had vigorously tried to help get service learning embedded in a structured way where we had a center or at least a central unit that was connecting faculty, students, and community to do service learning on a sustainable plane. And so that's something that I will try to pick back up on in my new role. So thank you for those questions.
Yes, and if I can help you, I'm always available.
Okay, thank you.
You're welcome.
Thank you so much, Dr. Robert Lewis and Dr. Adams Cooper. We have about slightly over a minute. This system will knock us out in so soon. So before that happens, I would like to thank all of our presenters for your insightful and constructive presentations, and to the audience for your questions and for making this a very intriguing dialogue. And I hope you enjoy the rest of the conference. We have sessions later and also tomorrow and Saturday. So thank you for being part of this panel. And take care, everyone. Bye-bye.
Thank you, presenters.
Thank you.
Thank you.
Thank
Thanks,
you, Dr.
everyone.
Kai.
Thanks,
I
Jane.
love that name, Dr. Kai. I love it. Yes.